the future nurse-patient relationship and nurse-patient relationship in constructing of the professional identity in nursing. The future nurse-patient relationship is an important part of the social context where future nurses learn their profession along with their relationships with the doctors, the experienced nurses, and other relationships they observe in their clinical practice context. Next to the technical training, which is the main reason for the clinical practice, the role of their relationships with the patients in their learning proved to be more important than expected. Considering the importance of the future nurse-patient relationship, it is interesting to see how future nurses value their relationships with their patients and what is the meaning they gain from the way they see the experienced nurses interacting with their patients. What kind of stories are kept by the future nurses as significant from the experienced nurses? And how do they use these stories in conducting their relationship with the patients? The data used in the research was the result of the conversations based on stories considered significant by the future nurses collected in the semi-structured interviews, which allowed the identification of the participants' preferred identities as future nurses. The participants were students in general medical care specialization in a post-secondary health school. There were 13 conversations over a period of 2 years, attended by 53 respondents, 3 being as central storytellers. And we used grounded theory to analyze the data. These meetings were held in a program inspired by Rita Charon and her activity at Columbia University in USA, the program called Narrative Medicine Program. And we used also outsider witness practice to do the interviews, which is a practice derived from narrative approach. If we think the social constructionism, to which Berger and Lachman had a significant contribution, and we are thinking about the context in the medical field, we need to consider everything that means health policies, government decisions, policies of the institutions where the medical staff works, ways of interaction, organizational climate, patients and professionals' relationships, technological development. Schotter considers that the sphere of dialogical activity implies a meaning that goes beyond the simple representations, contributing to the other forms of knowledge later available to the individual, having importance in the construction of what he calls personal and social identity. Sandhu and Unguru consider the constructs tools through which individuals find meaning, configure, and shape their social reality, social construction as being described as oriented towards meaningful stories, where the process is more important than the construct itself. The process of meaning construction can start in this context from the use of the constructs already acquired by individuals before the hospital, their experience in the hospitals, but they may need also to purchase new constructs to help in acquiring the medical reality, considering the complexity and the speech specific to the medical field being difficult, especially for novices and the patients. Human beings are considered an entity that expresses itself through stories, which formulates its reality and makes it known to the others through fragments of narrative, moments told in time and space, reflected upon and understood. The narrative inquiry gives more importance to local stories as they are lived stories and can be viewed as the immediate reality of the narrator, which have greater significance for him than the general universal truths. The socialization issue of the future nurses in the clinical field is seen like being diminished because of the negative models between the experienced nurses and their lack of interest in teaching and mentoring for the future nurses, which are rather identified as a workforce who can serve them. He also, this work, emphasized on the importance of the positive behavioral models of the experienced nurses because he thinks that having an impact on shaping the future nurses' attitudes and behaviors. The preferred identity descriptions coming from their patients are very touching for some respondents, future nurses, because they are interpreted like a direct consequence of their behavior with the patient, so they are based on reality. The students gain access to what is called what others thinks about you when being a nurse, where others represents the patients. The image of the desirable nurse validated by the patient can motivate him or her to want to keep that kind of being as he was described by the patient, which brings him satisfaction, and to influence his action as future professional in the medical field, shaping what we could call intentional professional identities. But what are the significant stories about? The stories are about the emotional and moral support granted unconditionally, the need of authenticity in establishing the relationship with the patient, equality, having a sense of humor in relation to the patient, talking with the patient, to cheer the patient when needed, etc. But the focus of the future nurse on the moral support of the patient and communication can come from the need to compensate the technical part of the training, which is still developing. For example, if the experienced nurse does not have enough time to talk with the patient, and the future nurse have experienced the gratitude of the patient after spending some time with him, he might be tempted to repeat this kind of behavior. Nonverbal communication is described as a method to support the patient by one of the respondents, and he said it is especially needed when the patient is unconscious or not completely conscious. The intervention of the experienced nurse is described like limited to the procedure by a respondent, ignoring the nonverbal of the patient. This could be explained because of a tendency of the training nurse to compensate their helplessness or the technical aspects not known yet with the psychological and emotional support for the patient, but also to be able to do something to contribute in any way to the medical team effort to help the patient, or also to correct the professional's interventions by offering a complete caring as it is provided in school. Suikkala estimates that the interest of the future nurses, especially in the first year of studies, is mostly oriented on the technical aspects, and then after gaining some trust, they're orienting on the relational part of the patient relationship. But the data of our study show a tendency of emotional compensation of the shortages on technical skills, probably because of the future nurses wish to be useful. When it comes to communication, future nurses can practice their skills to interact and to connect with the patient, probably because they already have the expertise of the human communication, and that can be a part of their proven preferred identity of caring nurse attentive to the patient's needs, which are in the same line with the idea of caring. Having pity for the patient is another kind of story, which was coming from the stories of the students. Some respondents reporting themselves emotionally impressed by the situation of some patients, some of the future nurses' reactions being helplessness, joy, sadness, most of all being connected with the future nurses' perception about the patient's condition. These reactions become a kind of motivation to action. If the patient is sad, they will try to make him smile. As Suikkala et al. Would say, he gets preferred outcomes from the patient if the patient is smiling, for example. There were stories where the students were seeing the focus of the experienced nurse mostly on the procedure, like a lack of pity. In extreme situation, they manifested the wish to be helpful to the others, and it was seeing like a preferred identity description being like a moral duty by some students, but also as a character trait learned in the family. Sometimes it reveals the wish of the future nurse to prove his or her utility or to have any contribution in extreme situation, like it was in the report of one respondent who was involved in a CPR maneuver. But what's interesting from what she says is that need of being a person who matters for someone. Bureaucracy, it was linked with the lack of time. The stories from the future nurses bring into attention the stories they were involved in for the stories from the patients who complain. But the respondents choose to reject the image of a nurse who has no time for the patients, being over her head, covered by papers. The lack of time is seen from two perspectives. One, which is this problem justifies the lack of involvement in the communication of the experienced nurse, and one which blames the nurse and suggests that they are waiting for gifts or informal payments to say a nice word. For future nurses also experienced the lack of time during the clinical practice, but they say, if you want, you can have time for 1 or 2 minutes to talk with the patient. The lack of time is also explained by the respondent in certain conditions, like a lack of goodwill from the nurse, even if they had experienced what it means to be caught between the need for time to fulfill your duties and time for the patient. To be like a robot is also linked with not having time. One of the respondents considering the dialogue a must and an opportunity for the nurse. And he is using a discourse specific to the medical field, which is saying that there is no disease, there are sick people. Informal payments are also some stories coming from the students. Understanding the phenomenon of the informal payment and of different favors using money or the power is not described like a preferred identity. On the contrary, it is rejected by the future nurses. One of the respondents described the informal payment like a way to condition the medical intervention. Also, to label a patient comes from the stories of the future nurses. Being a part of a minority group can involve labeling behaviors which are enacted by the community, and the group label is associated with their reputation and influence the identity of the individuals. There were more stories which involved labeling. Usually the future nurses witness situations where the doctors and the nurses labeled the patients when it was about some conflict situations. Not care. From the patient perspective, in a respondent account, describes some behaviors of doctors and experienced nurses which were perceived by the patient like lacking understanding. The respondent is criticizing this kind of behaviors and apologizes from the patient trying to explain their behavior in front of the patient. So the future nurse is trying to get away from this kind of label of not caring. And more, she is the student in nursing is apologizing from the patient. In conclusion, we can say that the aspects perceived like being negative by some students prove to have their role in the process of constructing the nurse's professional identity, like counter models or negative models. The most important element for the students in nursing seems to be the patient being empowered by the student through the validation role in the process of learning, and also in the way that future nurses are seeing and developing their professional identities. The relationship with the patient seems to change the power dynamic and the future nurse experience nurse relationship, the student behavior having the benefit of the patient as a validator. In some cases, the observed relationships between the experienced nurses' patients are a positive model. In some other cases are a counter model when they try to underlie their different attitude, and in others, the students are trying to complete the experienced nurses' actions in order to offer complete care and to be closer to their preferred identities, which are developed through dynamic interactions from the medical context. What is important is that they collect that kind of stories and that they are taking those stories to their preferred identities, which are linked to being professional, but also being human in the interaction with the patient.